So from my understanding, from what I can see on my side of the computer, we are all started. Um, Welcome everyone, and thank you for joining us for this important discussion of eviction prevention and rental assistance and homelessness in the wake of COVID-19. Um, my name is Hallie Holmes, and I'll be kind of doing a little bit of welcoming and introductions, and then I will hand it over to Maya to continue on introducing the panelists and kind of the issues that we're facing. So just a brief overview. Since the start of COVID-19 public health emergency this past March, the District of Columbia has responded to threats to housing stability during the COVID-19 public health emergency. They've done things such as legislating significant emergency eviction prevention protections, augmenting existing or creating new rental assistance programs, and providing additional services to people experiencing homelessness and to improve their capability for social distancing. Nonetheless, the district is still facing an eviction crisis 60 days after the public health emergency ends. Calls to moderate certain protections and uncertainty about federal emergency aid to assist tenants and landlords in paying their bills. So for this panel, our panelists will provide up-to-date details on the eviction moratorium and related protections, public and private emergency rental assistance programs, and how homeless services system is adapting to serve people experiencing homelessness during this time. And I'll leave the rest for Maya to go through. Just some virtual housekeeping. If you see me looking over here, it's because I have two screens. So this is a Zoom webinar. That means that your video is turned off as well as your mics are muted, and that will be that way for the entire webinar. Therefore, if you have questions or any comments, we ask that you use the Q&A function that you can see at the bottom of your screens right now. The moderator and panelists and myself will be monitoring the Q&A function as well as the chat function, which you're more than welcome to use and also put questions into. There's also an option to raise your hand. I'm sure you see at the bottom of your screen. We will not be using that function, so I would advise you to not click it. I mean, you most certainly can, but we will not really know what that means. And we would request that you put all questions into the chat or the Q&A. And if you have any technical problems, you can contact me, and my email is hholmes, HHOLMES, @cnhed.org. So with all that said, I am pleased to introduce our moderator for today's panel. Maya Brennan is the Housing Policy Advisor to Councilmember Alyssa Silverman. She got her start in the housing field as a landlord-tenant hotline counselor at Baltimore Neighborhoods, Inc. After her time on the landlord-tenant hotline, she has worked in policy, research, and strategy roles at the Urban Institute, the Urban Land Institute, and National Housing Conference. Throughout her career, she has worked to identify and address housing policy program changes that could protect residential stability and promote a well-functioning housing system for renters and owners, as well as elevate residents' voices in policy debates. She has a bachelor's degree from St. John's College and a master's in urban policy from the New School. And so with that said, Maya, I'll hand it right over to you.
Thanks so much, Hallie. So really, it's an honor to be here with you, with the CNHED family and network, with our panelists and everyone here today to talk about eviction prevention and rental assistance and homelessness in the wake of COVID-19. These are really crucial and interwoven issues, especially in a place like the District of Columbia. It's an expensive place to live. It's a city full of renters. It's a city full of displacement and of heartbreak, and a city full of joy and excellence. And we need to be able to make sure that our policies and programs are enabling the joy and excellence and trying to minimize the displacement and harm. It's a place that draws newcomers seeking stable work when jobs dried up back home. And it's a place where families, especially Black families, have put down roots for generations and need to keep those roots. And it's a place where other families, especially white families like my own, have either uprooted themselves from the district into the suburbs in the time of white flight, or uprooted families of color as they moved back in. So we need to be mindful of all of this context as we start our conversation today. The pandemic certainly risks making every inequity worse. It's up to all of us who work on equity and define equity in human terms rather than financial ones to work together right now to avoid worsening the district's rental crisis, and hopefully use this moment to hit reset on some of the problems that we have in our system at the moment. So you're here today, as Hallie mentioned, about eviction prevention, about rental assistance, about the importance of our homes in our lives and what we need to do to be able to address homelessness and avoid new entrants into homelessness. Our conversation is going to really focus on the District of Columbia, but I welcome anyone joining from other states or jurisdictions. We can always learn from each other and improve. Our panelists today are Beth Mellon of Legal Aid, Susan Jacob of Housing Counseling Services, and Adam Rokap of Miriam's Kitchen. Beth is a supervising attorney in the Housing Law Unit at the Legal Aid Society of the District of Columbia and the director of Legal Aid's Eviction Defense Project. She represents tenants in cases involving eviction, housing conditions, rent control, and the Tenant Opportunity to Purchase Act and other matters. She's also active in policy advocacy at the council with several district agencies and with the DC Superior Court. She's also the chair of the Board of Trustees for Beacon House, a nonprofit community-based organization that provides academic support, mentoring, and athletic programs to school-aged children in the Edgewood Commons Affordable Housing Community in Ward 5. She has a BA from Wellesley College and a JD from Harvard Law. Next, Susan Jacobs is the program director at Housing Counseling Services, a nonprofit organization founded in 1972 to provide comprehensive housing counseling, training, advocacy, technical assistance, and housing opportunities for low and moderate income homebuyers, homeowners, and tenants, and to help its clients achieve successful living in healthy, safe, and affordable homes. Susan has worked at HCS for the past 11 years and began her tenure there with the Metropolitan Housing Access Program, working with people living with HIV and AIDS. She then moved to the Emergency Rental Assistance Program and has served as program director of this vital program since 2013, providing financial assistance and counseling to low-income residents in Washington, D.C. who are facing eviction and housing instability. Susan has a BA in both political science and in economics from the University of Maryland, College Park. Our final panelist, Adam Rokap, is a licensed social worker and the deputy director of Miriam's Kitchen, a nonprofit organization working to end chronic homelessness in DC through outreach, connections to services, housing, and advocacy. He's active in DC's Interagency Council on Homelessness, particularly in efforts to end veteran and chronic homelessness. Prior to working at Miriam's Kitchen and attending NCSSS, he worked with homeless seniors through the Jesuit Volunteer Corps in Oakland, California, and did community service work or community support work with adults living with severe and persistent mental illness at Green Door right here in Washington, D.C. He has a Master of Social Work degree from Catholic University. So each of our speakers are going to present for about 15 minutes each. They will then open it up to questions. While they're speaking, feel free to use those chat and Q&A functions. We'll draw questions from there after everyone has spoken, and I may add some of my own. And finally, before we get started, I just want to acknowledge here that when we talk about race, it's racism, not race, that affects Washingtonians' risk of eviction, of rental hardship, and homelessness. So predicting exactly how a policy or program gets upended by racism, however, it takes an awareness of both the subtle and the not so subtle ways that racism and anti-Blackness and xenophobia and all of their kin take root and combine and shift results toward an inequitable status quo. So our panelists here recognize that we need both our own eyes and others' eyes and ears and minds contributing to solutions and pointing out when we, especially those of us who either are white or grew up and learned in white-dominated spaces, fail to see the problem or the opportunity as someone with lived experience might. So we'll try to call ourselves into awareness as we recognize that, but we welcome all of you to do so as well through those question and chat functions, because silence keeps us exactly where we are, and we hope to get somewhere that's actually different and more equitable. So with that, I'm going to pass it to Beth, who is going to take the first round.
Hi, everyone, and thank you, Hallie and Maya. So my name is Beth Mellon. I'm with Legal Aid, and I'm actually going to start off. I just want to talk a little bit about eviction generally in DC. So if we can go to the first slide. So Eviction in DC was really at a crisis point before the pandemic. We have 30,000 plus eviction cases filed every year. A report actually just was released by Georgetown last week that has some details based on data they pulled from 2014 to 2018. And so they found those 30,000 cases affect 18,000 unique households, which is 11% of all renters in DC. And so that number alone, I think, tells you kind of the scope of eviction impacting tenants. And of those tenants that were sued in 2018, when they looked at those cases, they found that more than 60% had a prior case during that same time period. So there are a lot of tenants who are sued multiple times. It could be several times a year. It could be multiple times over a short period of time of a few years. Most of these cases are about non-payment of rent. That's 93% of the cases. And the average amount due is actually not that much, relatively speaking. I think this is important when we think about how can government resources help and what's the most, kind of efficient and effective use of government funding. And so keeping a tenant in a home actually is not that expensive per family often. So the average amount of rent due was a little over $1,200. And then the other thing that this Georgetown study highlighted that certainly I have seen in my practice, and I should say I've been handling eviction cases for 15 years in DC, is a lot of tenants in subsidized housing still struggle. And so even though their rent is based on income, that is 23% of all eviction cases are tenants who are living in subsidized housing and paying rent based on income. If you can go to the next slide, please. Thank you. And eviction court, which I have spent a lot of time in DC, really is a tale of unequal access to justice. So all the time I hear folks say, DC has amazing landlord-tenant laws, and this is true. But our court system overall, not just landlord-tenant court, is set up for lawyers, not real people, to navigate. And so in this court system, eviction court in DC, 90 to 95% of landlords have attorneys, but only 10% of tenants do. So these great laws, but it's really hard to kind of effectuate those laws and get the just outcomes that tenants should get if they don't have an attorney to help them navigate that process. So first of all, a lot of tenants just don't appear. There was a great investigation done by DCIS that became public that showed last week that showed that 2 process servers who handle almost 2/3 of the cases in DC were just lying, like flat out lying, saying they were serving tenants at 2 places across the district at the same time, saying they were serving tenants when they were sitting in a court in Maryland for a DUI charge. And so this really just exposed something that I think, as someone who talks to tenants all the time who are facing eviction, that we see tenants reporting to us, I didn't get the papers, I got the papers the wrong way. And unfortunately, the court was not crediting tenants saying that and not believing them. So that investigation is really important, hopefully will cause some changes, and the council's already responded to that, which I'll talk about later. Most tenants who come to court, they just enter these one-sided consent judgments, these pretty terrible agreements where a tenant pays back all the rent that's owed, doesn't get repairs, has to pay it on a very short time frame in 30 days. A judgment is entered against them. So it's not even a settlement agreement. It's a judgment that can be executed against that tenant pretty quickly if they miss a payment. And when you look, a lot of cases are dismissed, and that's great. But of the cases that are not dismissed, a lot of those tenants eventually face at least the risk of eviction. So in half of those cases, a writ, an order for an eviction to take place is issued, and in 20% of them, the tenant is actually evicted from the unit. The difference between those, a lot of those tenants move. And so, the tenant may, or the family may not be actually evicted, but they're still forced to move, and that can be really damaging. If you could go to the next slide. Thank you. And I should say, these photographs are legal aid clients. This individual, who I'm not gonna name for privacy reasons, but is one of my former clients. So the other thing that Georgetown study showed that we know is evictions reflect really deep racial disparities in the district. So the disparities we see in income, in wealth, are then repeated in the eviction process. So 60% of eviction cases in DC and actual evictions are for tenants who live in wards 7 and 8, but that those wards only have 25% of the units overall in the city. And both of those wards have populations that are 90% plus Black families. Other wards have a lot lower eviction rates. So in Ward 8, 25% of renter households every year get an in 2018 got an eviction filing. In 2018, it was only 3% of renters in Ward 2. So that's a tenfold disparity. And if you look at the neighborhood level, and I didn't want to add slides and put this graph, but it's literally a line, just almost a perfect line, that as the number of Black residents go up in a census tract, the eviction rate goes up. And so I recommend that Georgetown study if you want to look at the numbers in it. They have a graph that's really startling on this, but unfortunately not surprising in many ways. If you can go to the next slide. And so the other thing that we know is how devastating eviction is for families and for neighborhoods, and frankly for the government and for landlords. So families who are evicted, of course, there's the risk they go into the homeless services system, and I know Adam will talk more about that. They also lose valuable possessions often. They can't always move things. Even if they move things into storage, they may be lost eventually. And that is, you know, a lot of our kind of wealth can be built up in our possessions that we hold, in the furniture that we have and appliances that we have that are really expensive to replace. For children who face an eviction or a forced move, it's associated with poor school performance, health problems. For adults, higher unemployment, job instability. You're more likely to lose a job or have trouble with your job once you face an eviction or forced move. And then anxiety, depression, suicide, even. And I will just note, of course, that these challenges are many of the same challenges that right now, because of COVID-19 and the pandemic, these same families who may face eviction are already dealing with. They're already dealing with unstable or lost employment. They're already dealing with the challenges of attending school, in many cases remotely right now. They are dealing with, you know, the kind of anxiety, depression, health effects, unequal access to health care that happen already. Evictions also are costly for landlords. They end up paying several $1,000s, especially in a place like DC. And then, of course, if families go into the shelter system, that's expensive for the district, but also costs for healthcare, the child welfare system, other safety net programs go up when a family is homeless or forced to move. And families who are evicted also often, when they move, if they're able to go into a new place, end up in substandard housing conditions. They face a lot of discrimination merely from having an eviction case filed against them. It makes it very hard to find replacement housing. And that is something that our case manager, who helps tenants search for housing, encounters literally on a daily almost basis with tenants she's working with. Next slide, please. So we also know that during the pandemic, district residents are struggling. You can see I'm a data person, so sorry to keep throwing numbers, but almost half of district residents have lost income. We've had over 150,000 unemployment claims filed in the district as of this week. And there are also higher expenses. And so I know a lot of us are focused on lost income. Obviously, lost income is devastating, especially if you lose your job entirely and don't have replacement income. But, you know, food costs are higher, transportation costs can be higher. If you don't have adequate healthcare coverage or access, you end up paying more. Utilities, we're all at home now. And so if you pay your own utilities, those bills are higher. And so for families who are really living at the margins, they can't, you know, often cannot afford those increases in costs that, you know, to other folks may not feel like a big deal, but they really can be for so many families. And so there are some wide estimates based on census survey data, but as many as 50,000 families in the district right now are not current in their rent or have little or no confidence in their ability to be able to pay next month's rent. And then about 60,000 households are saying that they are having trouble paying their basic household expenses, such as rent. And so where that leads us is to things that the council has done to try to protect tenants. And I will say DC has some of the best protections in the nation right now for tenants who may be facing eviction. So right now, the public health emergency extends through the end of the year. There can be no actual evictions during the public health emergency, and landlords cannot serve a new notice to vacate, which is often a prerequisite to an eviction case, or they can't file a new eviction case itself for the public health emergency or 60 days after. And then there was some emergency legislation last week on process servers because of that issue I had mentioned, that they're going to have to start providing time-stamped photographic evidence of service to hopefully cut down on that fraud. Landlords cannot increase rent during the public health emergency or for 30 days after. They can't charge late fees during the public health emergency. And then there is a requirement for landlords to offer payment plans to tenants during the public health emergency and for 1 year after. I will just note, I'm happy to talk about this during Q&A if folks want to. For a lot of the tenants that legal aid works with and is hearing from, those payment plans are not actually helpful at this point because so many tenants have not recovered their income. They're not in a position to be able to pay their regular rent and catch up at this moment. Next slide, please. So what do we think we're facing? Only 8,000 cases have been filed in 2020. Ordinarily, we would have had about 30,000. So we already have a big gap or kind of deficit of cases that even if it was normal economic times, you would expect a big flood whenever the courthouse doors open. And if filings increased by 25 or 50%, just based on some of those figures I was giving you about folks who have lost income and are really suffering, you could see 45,000 cases filed. We could see more. And the national estimates have been saying 20 to 40,000 cases. And that's assuming that not every tenant, frankly, who is behind gets sued. So some landlords may choose not to go to court to work with their tenants. And even still, we are expecting that we will have a massive number of cases. And what's also different, I know this is obvious, but it may be worth saying it out loud, that they will all be filed at once. Not literally on the same day, but I mean, we could see these filed within a 30 to 60 day period, right? And so in a normal year, it may be spread out across 12 months. We're talking about that or more squeezed into a month or two all at once, which is going to be very hard for us. It's going to be hard for folks like housing counseling services to try to approach such a huge volume of folks in need all at once. And then finally, I will talk more about this, but legal aid's point of view, rental assistance has increased, but probably still is not nearly enough. So national estimates are that the district might need $50 to $150 million to pay the rent that hasn't been paid during the pandemic. Total funding right now is about $40 million. I think that's right. I've been trying to follow the numbers as little things are added. And some of that funding has already been depleted because that includes funding for last year, that fiscal year that is now over, as well as fiscal year 21 that we just entered in the district. And so what does legal aid recommend? We think some of these protections should be extended. So actual evictions right now cannot happen during the public health emergency. We recommend adding at least 60 days to that. Extend the freeze on rent increases for at least a year after the public health emergency. I know some folks have proposed even longer, and we would certainly support even longer. The payment plans require tenants to pay back rent over 12 months, but at this point, the more you owe, even if you spread it over 12 months, those payments are going to be really high. And so as the pandemic increases and folks may owe a larger sum, it needs to be spread out over more months. So we would say increase that to at least 18 months. And then something that definitely is being talked about at the council right now that legal aid and others are opposed to is an exception to the eviction moratorium for certain types of cases. Happy to talk more about that. But we have a lot of concern about what any evictions would mean for public health right now, and also how an exception could be abused, even if it's intended to be narrow, given all this kind of pressure that's building up in the system. Increased rental assistance, but also think about alternatives. There are folks calling for cancellation of rent, or landlords having to apply for assistance. There could be incentives offered to landlords to forgive rent. Or I know something that at-large council candidate Ed Lazier has called for is just don't allow tenants to be evicted for rent they owe during the pandemic, that they might still owe it, but they couldn't actually be evicted for it. And then the other thing is some of the things that council's done that I didn't mention, around eviction record sealing, fair tenant screening for tenants who are looking for housing, the process server reform, is to make all of those things permanent so that tenants would enjoy those protections after the public health emergency and kind of as we come out of the public health emergency. And that's what I have. Thank you so much.
So we're going to turn it over to Susan now. Susan, go ahead.
Hi, good afternoon, everyone. So as Maya explained, I'm from Housing Counseling Services, a program director for our rental assistance programs. And just as she explained, Housing Counseling Services is a nonprofit. We've been around since 1972, and we work to help clients resolve many housing obstacles that they may encounter in DC, Maryland, and Virginia. You can go to the next slide. So I'm just going to briefly talk about the rental assistance programs that are available currently at Housing Counseling Services. Some of these other programs are also administered by other agencies in the district. And I'm happy to take questions about any of them, after the presentation is over. So initially we have the COVID Housing Assistance Program, or CHAP. This is the program that came out of the CARES Act and was started in July of this year. So this program is a federal program, and so cannot be combined with any other federal programs that are available. So for example, the COVID Tenant-Based Rental Assistance Program, or TBRA, or SSVF, MAP, those programs are all federal programs. So anyone who is utilizing those programs and maybe receiving a subsidy would not be able to use the CHAP program. People who access the CHAP program generally have a little bit of a higher income. The income requirements for COVID are up to the 80% AMI. And so as long as someone is a district resident and meets the income requirements for that program and can document some sort of COVID-related emergency, they would be eligible for assistance for that program. This program can be combined with the ERAP program, or Emergency Rental Assistance. ERAP is district funds or local funds, and so it doesn't have the same requirement of not being able to be used with another program that may have federal funds. There have been emergency changes made in the legislation to the ERAP program. I'm going to go over them generally. The the Department of Human Services is actually working currently to implement those changes for the program for this fiscal year. And so more information on the implementation of that will be coming out from DHS. But just some of the basic sort of things that have happened with the emergency legislation. We are working very hard to lower the documentation requirement for the program to make it much more easily accessible for people, especially many of our residents and tenants that are experiencing gaps in technology. Obviously, due to the pandemic, we've been relying a lot more on technology to help us access programs and help people get information out to people, ensure that people are aware of what is out there, and then also assist people in trying to apply for programs. And the technology gap does hinder some people's access for these programs. So I know that obtaining documentation, for example, such as bank accounts, things like that, are difficult for some people. And so part of the legislation, the emergency legislation, is to lower that documentation requirement and potentially provide self-certification requirements, so someone can self-certify and say, what their income may be or what documents they may not have. Also, I know that the amounts of the rental assistance are going to go up. And at this point right now, the amounts are $4,250 or $6,000, but the emergency legislation allows for for us to look at the bedroom size and the fair market value of the unit, and in that way determine the amount of rental assistance. There will be much more concrete information available once, as I stated, the Department of Human Services completely works on implementing that program. The amount of ERAP assistance has gone up for this fiscal year, and also will be potentially utilized much more because the income requirement for ERAP has also gone up. So previously it was 125% of the federal poverty level, which is a very low income limit. However, now it has gone up to 40% AMI. And we also looked at eligibility for the ERAP program prior to the COVID housing assistance program, where now many more people will be eligible for ERAP versus CHAP. The 202 Assist program is for Ward 8 residents only, and this is a donation program that was started by John Wall. And this program is available through Lydia's House, and so people would have to apply through Lydia's House. However, if someone is a Housing Counseling Services current client and has applied for other programs through us, then they are automatically looked at for the 202 Assist program if they're a Ward 8 resident. This is a very low barrier program. All you really have to do is document that you are a Ward 8 resident and that that COVID has affected you, and essentially the program would be able to assist with $1,000. That is the maximum amount of assistance you can receive with the 202 Assist program. The TBRA or COVID TBRA program is, I put it in this presentation so that people are aware that what was one of the first programs that the district rolled out, also federal funding through the CARES Act. It is actually over at this point in that all the funds have been accounted for, but we did want to point out that the district did a great job in rolling out the program. It was the initial program that got started. The buildings that had 50 units or less were ones that were targeted for this program. And it was a program that did assist for up to 6 months of rental assistance. However, it was based on not the whole amount of rent wasn't paid. So there were portions of rent that the tenants still had to pay, and it could be applied with the emergency rental assistance program. Because it was also a federally funded program, it could not be combined with CHAP. However, it could be combined with ERAP. And so we were able to use those programs together at some points for some of the residents of the district. The last two programs are programs that are at Housing Counseling Services as well. The Supportive Services for Veterans Families program, or SSVF. And this is a program that does help veterans and veteran families with financial assistance, security deposit and first month's rent, as well as case management, intensive case management services. And then the Metropolitan Housing Access Program, or MAP, this is the program that is essential for people that are living with HIV or AIDS. It's the Housing Counseling Services is the agency in the district that administers the MAP program, and services under the MAP program are very broad. There were COVID funds that were passed through for the MAP program as well. So there are COVID specific funds under MAP, as well as funds for food assistance, food cards are given out, rent, mortgage, utilities, and there are various programs under the umbrella of MAP that can be put together and used to try to assist with many aspects of housing, as I mentioned, rent, food, utilities. Could you go to the next slide, please? So the biggest question that everyone always wants to know is, how are we trying to use these programs together, and what are the best ways for clients to use these programs? So we at Housing Counseling Services, we try to use a very client-centered approach. We want to understand what the client's situation is and then direct them to the correct program to use. Some of these programs can be used, or as we say, stacked together. So as I said, the ERAP program can be used with programs that are federal programs, since ERAP is not a federal program. And there are times when we may say, okay, you can use the ERAP program, sounds like a good program for you, as well as the CHAP program. And you can use those two together in order to try to resolve your rental delinquency and maintain housing stability. The determination on how to use these programs together, including MAP and SSVF, not just CHAP or ERAP, really comes after we have a conversation with the client and really understand what's happening in their housing situation. As I stated before, DHS is currently working on how to implement the ERAP emergency legislation changes. The biggest it is going to affect how programs are used because many more people are going to be eligible for the ERAP program, given that the documentation requirements are being lowered, the income has been raised, and the amount of assistance is also going up during the public health emergency. So this is going to change how we as an agency look at the program, as well as how DHS looks at the program. And we believe we are going to be helping many, many more people with the implementation of the emergency legislation. I just wanted to point out, because this is a question that we always get regarding appointments for specifically ERAP and also for CHAP, the best way to obtain those appointments are through the DHS and DHCD portals, which is the links are found on the respective websites. That is the best way to try to get an appointment for these programs, given that there is a high volume of people that are trying to access them at all times. I didn't mention earlier that the ERAP program, we are one of 6 agencies that also administers that program. There is also Catholic Charities, the Community Partnership, Salvation Army, United Planning Organization, and the Greater Washington Urban League. Those other 5 agencies also administer the ERAP program and also can be accessed through the portal. So when someone goes onto the portal to apply for a program, to try to get an appointment, they are getting access to 6 agencies and their schedules, as opposed to trying to call Housing Counseling Services, which is only 1 agency, and trying to get an appointment with us. For the CHAP program, there are 3 agencies that work with that program. So it's Housing Counseling Services, United Planning Organization, and the Greater Washington Urban League. And so the same thing applies for the DHCD portal, in that you have access to 3 agency schedules instead of just 1 specific agency. Could you go to the next slide, please? So I just wanted to provide some contact information because I know this is really, this is a question that everyone has. For Housing Counseling Services, for anyone who has phone inquiries regarding how to access programs, the number is right there, the 7339 number. We have specific emails for ERAP and CHAP, and we also have an info at Housing. So if you have questions regarding any program I just spoke about, including SSVF or MAP, you can definitely email any of those emails to try to get more information or to see how appointments can be set up. And then I also have my information on here in case anyone has any questions after this presentation. Thank you.
Thanks, Susan. Adam, you can go ahead. Get started.
Great. Thank you so much. And to everyone that's on the call, so good to be with you virtually and for all your interest in this topic. So I'm going to be talking a bit about, what's happening with homelessness now during the COVID-19 crisis, as well as, what should we be doing when we're anticipating a potential spike in evictions and potential spike in homelessness. So I'm the Deputy Director at Miriams Kitchen, and we're a nonprofit that focuses on ending long-term homelessness in DC. We have a lot of direct services programs like meals and case management that we operate, street outreach, housing. And we also do a lot of advocacy work, both directly as Miriams Kitchen and then also through the Way Home campaign, which is a campaign to end chronic homelessness that we co-founded and helped lead, that has over 100 partners and 5,000, and over 5,000 members. So what's happening in homeless services right now during COVID-19? So there has been a ton of things that have happened to adapt the homeless services system since the pandemic started in March. The Department of Human Services is the lead DC agency that has been doing a great job being a leader in helping the whole homeless services system adapt and shift and figure out the safety precautions that we need to do. We've seen the Interagency Council on Homelessness play a great leadership role, as well as so many nonprofit and other partners that are on this call today included. I mean, some of the COVID-19 safety precautions in homeless services are things that you're probably used to seeing everywhere. So when people are accessing shelter, there have temperature checks and screening, contact tracing, and lots of great like testing protocols if there's ever positive cases. You see things like at Miriams Kitchen for our outdoor meal program, or for our meal program, we've moved everything outside, make sure everyone has masks, help with the social distancing. So in some ways, most of all the services are still there, but they look very different. A little bit more about what's happening with shelters. If you go back a slide. For shelters, the city is focused a lot on making sure that there is, we're doing as much for social distancing and having less density in the shelters as possible. So for, especially in the single adult system, and it's the single adult system that I know the most about. I'll try to touch on families and youth when I can, but I know the most about the single adult system. All the shelters now are open 24/7 instead of 12 hours a day to try to cut down on the amount of time that people have to go in and out. They have lower amounts of people in each of the shelters. There's sort of a target in the around between 60 and 70% that they try to hit, so that there's fewer people in each shelter, which has meant having extra sites. They have hotels that are available for when someone is having COVID-19 symptoms or test positive or have been exposed. So there's special isolation and quarantine sites, which is great. And then the city also created a program called PEP-V, which stands for the Pandemic Emergency Program for Vulnerable Individuals. And the idea with that program was, how do we identify people who would be at the most risk or most vulnerable if they were to contract COVID? So seniors, people with any of the medical conditions that the CDC has identified that puts you in higher risk. And the city has created a lot of hotel rooms so that those individuals can be outside of the shelter system in a hotel room that's just by themselves or sharing with one other person. And there's actually another PEP-V set of units that is opening as we speak. We were having a van that was coming to Miriams Kitchen this morning to pick up some of the individuals who medically qualify, which was great. I think the other thing you'd see, like I talked a little bit about before, is a lot of adjustments to how day centers work, meal sites work, street outreach works. So I talked a little bit about how our meal program at Miriams Kitchen looks different. If you look at something like the Downtown Day Services Center, they don't have their full indoor operations happening at the day center, but they're able to give out meals outside. There's by appointment only ways to have people come do showers, laundry, case management, things like that. And I think you see similar adaptations across the system. If you're ever interested in getting regular updates about what's happening broadly across the homeless services system, DHS hosts a bi-weekly COVID-19 partner briefing, which is great. They're every other Friday, and it's tomorrow is the next one. So I encourage people to check that out. Next slide. So in some ways, like the homeless service system has figured out how to adapt and adjust to provide as much of the ongoing services as we can. It's hard because we're not able to do as much as a system as we need to and want to because of all the adjustments that we need to make. And that's really hard on people experiencing homelessness, sort of more stressful for everyone all around. But we haven't yet seen, the big spike in homelessness that we're all worried could come and we're trying to start to prepare for. When you think about homelessness overall, even outside of COVID, homelessness is a symptom of a lot of broken systems and a lot of inequitable systems, compounding, and then you see all that play out in homelessness. So whether that's systemic racism, like that we've talked about a bunch on the panel, or health inequities, or just general income inequality. All those things are always, failing and breaking and sort of leading to this phenomenon of homelessness that we see. But, we're really worried about how that all gets compounded through COVID-19, which itself, is playing out disparately, depending on race and a number of other factors. And how is that gonna, shape who's coming into homelessness and what pressures people are under. So when it comes to asking the question, how should we be preparing for this possible spike in evictions and homelessness? I mean, we think that the most important thing is a lot of the policies and that Beth talked about and Susan talked about is really looking at that upstream prevention through eviction policy and rental assistance work. We need to do everything upstream that we can possible to prevent people from becoming homelessness in the first place. Second, if people are going to become homeless, the homeless services system has some programs in place to try to help people who are at risk of homelessness or just becoming homeless getting back into housing in a stable place as quickly as possible. So the family system has the best model for that. The family prevention program has been around for a number of years and already serves a number of families who are starting to access the homeless services system and try to help them find a different creative solution. There's a newer program on the single side called Project Reconnect. And then the ICH is also helping the homeless services system try to think through, how we do sort of intake and sort of greeting and guiding people who are newly experiencing homelessness overall. That's called Streamline Intake. So those are all things that are important. They're in place. We don't know how they're going to have to adapt yet to what would a COVID-19 surge in homelessness look like. The solutions that we have right now might not be exactly the ones that are needed in a spike that might be coming. But those are some of the infrastructures that we have in place that we need to make sure are fully funded and are adapting in the way that they should. There's a lot that needs to happen around planning for shelter capacity needs. So this is the time of year where the system is already would normally be planning for the winter when we see a big increased demand in shelter. So the city has just been finalizing its winter plan and a lot of work has gone into that. They're making sure to plan for, assume that there's going to be an even higher need for shelter than would be normally the case in the winter plan or in a normal winter, as well as thinking through, what is the contingency plans if the need for shelter goes even higher than that. I mean, so much is going to depend on what happens with evictions and the eviction policy and rental assistance program. So much is going to depend on what's happening with federal assistance and how much that's going to help prevent people from becoming homeless. When could we use some of those funds to do the things we need to do? But we need to be planning all the time and doing contingencies now to make sure there's enough shelter if people need it. And then we also think that we need, just like always, we need to be investing more resources in proven housing solutions. We know that housing is what ends homelessness. We know that we haven't been able to invest as many resources as a city as is needed to meet the needs of people experiencing homelessness even before COVID. So when we have opportunities through the FY21 supplemental budget, or even looking forward to the FY22 budget, we need to always keep focusing on how are we putting more money into key housing solutions, as well as just making sure that whatever housing resources that we do have right now, that we're using those effectively and as quickly as possible. So for people who are matched to, let's say, permanent supportive housing, who are also staying in the PEP-V hotels, the quicker that we can help people, get through the housing authority process, get into housing, that's the solution that they need, and that's the safest place for anyone to be during COVID-19. But that also opens the space for more PEP-V capacity or more capacity in shelter, which helps us meet any needs that might be coming. Thanks.
Wow, thank you. Thank you so much, Adam and Susan and Beth. This has just been wonderful to be able to get all of the context and knowledge that you've added. And we have more than 30 minutes to be able to be in conversation and questions with each other. So I know a number of folks have used either the Q&A area or the chat area to be able to put some of those questions in, but please do feel free to continue adding to those. I've taken some notes along the side about questions to be able to pull out, but before we start digging into the questions there, I just want to reflect a little bit. I mean, as Adam noted, homelessness is really a symptom of societal failures. I'd add it's also a symptom of failures in a largely market-oriented approach to delivering essential goods and services. So we've got a number of opportunities for solutions among some of the approaches that we've heard about from Susan and Beth here as well. You know, thinking about rent assistance, both ongoing rent assistance and the sort of emergency rental assistance approaches that Susan shared about. The payment plans that are currently required but not necessarily working quite right. Is there something that we need to do and think about in terms of marrying some of these approaches or other ways to deal with a non-payment situation? But also eviction prevention processes and policies are part of this. I mean, we're sort of rethinking in this moment some of the problem resolution approaches for landlords and tenants, because we're in the middle of an eviction moratorium, and that very large dominant tool at the top of our toolbox of eviction is not there for addressing all manner of landlord-tenant situations in the district, not just non-payment of rent. So I'm wondering, and maybe we can percolate on this a little bit, and if folks have ideas in the chat as well, how do we deal with disruptive or dangerous neighbors in an ownership context? What could we do in thinking about how we deal with disruptive and dangerous neighbors in an ownership context to apply over to the landlord-tenant space? And are there other ways that we can either, help us sort of step down from the moratorium by having multiple tools that come first before eviction, or think about something, maybe a little bit differently? So I'm gonna start with one of the questions that came in through the side there. Jamie Ressa had asked if we've got a sense of, on the non-payment side, the percent of non-payment cases that are actually related to unemployment. Because, and I've heard this a lot, and we've seen in the data, when unemployment benefits are boosted, it seemed like it was actually helping renters pay the rent. So what sort of remedies might we think about that actually tie unemployment assistance, and when does that not really work? Maybe Beth, you can start with that, but Adam and Susan, if you want to jump in too, let me know.
I mean, I can say, so we have 30,000 eviction cases in an average year in DC, right? And so it's not, the pandemic is sitting on a system already where housing was very unaffordable in the district. We had a lot of existing racial disparity and so forth, displacement. Between 2000 and 2013, over 20,000 Black families were displaced from the District of Columbia. And so that is kind of the existing system that the pandemic is now kind of coming on top of, if you will. And so I can just say, from tenants who are calling us and reaching out for help, we are hearing from many tenants who have lost employment income. Some of them are employed. They may have lost employment for a period of time and then regained it, but most of them are not making the same amount of money. So they have reduced hours, or they were laid off from one job and got another job, but it doesn't pay as well. And I think the crisis is certainly affecting families who may not be impacted in quote unquote normal times, if such a thing exists. We work with some unions on the Reclaim Rent Control Coalition, and talking to folks who work for the union about their members. Some of those unions, 90-something% of their union members were laid off. Those union members, it's not like it's easy for them to pay rent in normal times, but those compared to others are good, well-paying jobs, you know, with folks who often are able to keep up with their rent. So it's definitely affecting a lot of residents who might not be affected in normal times. I just think we have to remember that before the pandemic, many district residents were struggling to pay their rent, paying half or more of their, you know, income every month towards rent. And so they are still at risk and always have been.
Thanks, Beth. Yeah, there is certainly a disparity between what income is coming in and what the rents cost here on a regular basis. So that's important to always keep in mind. We had another question from Christy Johnson about maybe resources that landlords may be able to apply for. So do any of you have any information on, you know, are there grants that landlords can apply for to help keep their properties afloat, or are there other ways that we might need to keep thinking more about what to do for landlords to keep them alive during this time where they may be getting less rent receipts? I know we don't exactly have the landlord side audience over here, but I don't know or like on the panel as much. But Susan, I'm curious if you've heard anything in the, you know, emergency rent assistance space, because I know some other areas have tried to make it possible for landlords, for example, to do the applications there.
Yeah, so I know that it's definitely an idea. There have been ideas that have been floated out about landlords potentially, you know, applying on their tenants' behalf or getting some sort of grants so that they could be able to, you know, at least maintain payments on their buildings. But I don't know of anything concrete. And I know at Housing Counseling Services, we tend to always want to leave that power and that decision in the tenant's hands, because we know that, you know, they would be, and us as an agency, we would be more sensitive to what the tenant situation is, and it wouldn't create an even maybe more difficult relationship between the landlord and the tenant. If the landlord is saying, well, here, there's this program, but I need to know, you know, this information about you, and there could be some sensitive information, information that the tenant may not want to give their landlord. So we definitely think that the program should be more tenant focused than landlord focused, just for the simple reason of what I just said. And also, yeah, so, but I don't really know of any specific programs that would be for landlords. So I'm sorry about that.
Yeah, no, that's fine. I mean, I would have to dig back a little bit to see if, since one of the things that happens in the district with legislation is that since we need congressional approval for any permanent legislation, we have processes to be able to say, we declare an emergency, here's some emergency legislation, but it expires. And so one of the questions that I would want to dig back on is whether we have adequately made sure that some of the types of programs that we did do some emergency legislation on early in the pandemic, like mortgage deferral requirements, are, you know, ones that we've been keeping up with. And I know the chairman's office has been pretty diligent in trying to make sure that we're not allowing emergency legislation to lapse before the emergency is actually over. But you know, there's the odd quirk of being the district with Congress over our heads. So on the topic of, you know, getting more straight to renters, one of the questions that came up, this was again Jamie Ressa, was about the rationale for funding emergency rental assistance to the landlord directly. They sort of likened it as, you know, giving nutrition assistance like the SNAP program to Safeway and saying, Safeway, like, you operate the credit for the person who comes in. Are there, is there any thinking that you would share about the like pros and cons of that? I can certainly imagine, cases or potentially political reasons why a program would end up set up that way. Susan, do you want to start with that? But I also see Beth looking like I'm nervous. Maya's going to call on me, so maybe you need to be next on this too.
I mean, I as I stated before, I mean, I could see, in theory, the potential for that to be, something that could help to alleviate some of the tenants' issues. But as I said before, I really think that when it comes to the landlord-tenant relationship and what happens there when a tenant is not able to pay, especially due to a situation like this where there is a pandemic and it's affecting not just the tenant, but a whole, holistically, everyone that's involved in this situation, the tenant really should be the one that has the ability, the decision-making, and the capability and the tools to try to go ahead and alleviate the situation that has happened. And the tenant is the one that knows what's best for their situation. And so, just going back to what I said before, I really think that possibility should not be the number one way that we look at all the funding that's coming down from the federal government and from the district. Beth, is there anything you want to add?
Yeah, I mean, I have a lot of thoughts that would go beyond the allotted time. There's so much around a program like rental assistance and so many kind of assumptions that we make that are built in, for example, about deserving tenants who deserve assistance and who doesn't deserve assistance. And I will say Housing Counseling Services is absolutely the best emergency rental assistance provider. And I'm not just saying that because Susan is here. They do such a great job. And I think really, for example, there are situations where tenants may feel like they have to agree that a certain balance is owed even if they want to dispute it, or certain fees are kind of rolled in. I think Housing Counseling Services does a great job of trying to ferret that out. We sometimes have situations where landlords just won't cooperate. We think that's illegal, but nonetheless it happens. It's hard to enforce those rights. And so I think on the one hand, rental assistance is critical, and I don't mean to criticize the program in that sense, but I do think we have to recognize there are a lot of things we do with government programs where we make folks who need help jump through a lot of hoops, and it can feel very disempowering to them. And I really appreciate that the council with the recent changes was willing to take down some of those barriers of documentation that can feel very frustrating when a family just needs help. And the last thing they want to have to think about when they need help is, where do I find all the birth certificates for my kids, or whatever the documentation is required, right? And so continuing to take down barriers to help, and I think all of us being sensitive to how assistance is provided and trying not to build negative assumptions into it, and trying not to impose limitations that send particular messages to tenants or landlords. And then I do think right now, because the kind of need is so widespread, the reason we're saying maybe we ought to challenge the assumption that tenants have to come show their need is because it might be much more efficient at this moment for landlords somehow to be able to get assistance directly, which we of course would say would be paired with forgiving rent. Perhaps it could be forgiving even more rent than the assistance the landlords get. And I will note, this does not apply, to every landlord by any means, but, the federal government had this paycheck protection program, and the Washington City paper did an article about owners and property managers who got this assistance and didn't pass it on to their tenants, and who are still demanding full rent from their tenants. And then some who did, to be fair. There was also in the article an example of a landlord who got it and said, we're going to have a rent forgiveness program because we got this assistance. And so, if landlords get any kind of assistance, it is good to think about how can that be shared, with the tenants, and recognizing that when tenants get the rental assistance and it's paid directly to the landlord, is maybe it kind of has to be, the landlords are benefiting very much from that, right? They're advocating for rental assistance as well for that reason. So I don't know that that really answered the question as much as surfacing. I just think there are a lot of issues with the way these programs are structured that are always worth thinking about.
Right, and it feels like there is quite a legitimate conversation to have about whether we should enable landlords to apply for assistance on behalf of tenants, whether we should enable more applying for assistance on behalf of a whole property with some strings attached, or if we should attach more strings to other types of programs.
I will say, and sorry to interrupt, I
No.
appreciate Susan's comments so much, though, about the independence and autonomy of tenants, because there also are tenants who go on rent strike in part because the District of Columbia doesn't have a legal mechanism for them to kind of withhold their rent and set it aside with the court before being sued. And those tenants wouldn't want rental assistance paid for them, right? They're doing it on purpose because it's the only way they think they have to force a landlord to finally comply with the law. And so I really appreciate you raising that issue, Susan, is definitely another concern.
Yeah, it's one of the few forms of leverage when there is a dispute. And I've certainly heard folks come through to us and say, I need some help addressing this. And no, I don't want to apply for rent assistance right now because I need to actually have a moment to be able to talk to a judge. So Adam, in terms of the homeless services system and needs on both homeless service providers right now and on prevention resources, sometimes we hear of this sort of tension between the prevention resources, which can go to things like that first month's rent or the security deposit or the rental assistance potentially, and the services needed. And it sounds like it's more costly. It makes sense that it would be more costly right now to provide services safely. Do you have any thoughts about what more we may need to do to work through that tension? Because one of the most heartbreaking things is to have a system that is kind of fighting against itself for the same too small resources.
I think it's incredibly important for us to be doing both. I think on a policy level, one of the things that's hardest to puzzle out in terms of prevention, when you just look at preventing homelessness in particular, is that it's not necessarily easy to predict who is actually going to become homeless. So there could be, some prevention programs or assistance that, get a lot of resources to people who are in a really difficult housing situation, who are living in poverty, absolutely need help. And that's great. Those are, families and individuals that may never have become homeless, even if they didn't get the assistance. So, part of our work, until we can live in a day where, like, if the federal government would, make a, just a commitment to affordable housing and, for instance, just make something like Section 8 an entitlement, it would not be that expensive of a program overall for the country and would probably eliminate most homelessness. So until we can get to that day where we can just, address the affordable housing crisis directly, and that would be the best prevention and the best for everyone. Until then, when you're just from the homeless services system, you're trying to be really smart about how do we take limited dollars and make sure we're getting it to people who are actually going to become homeless. And so that's where things like Project Reconnect and the Family Prevention Program are, good innovative ways that are trying to be smart about those investments. But, even if we start preventing everyone that becomes homeless, there are thousands of individuals and families who are living on the streets and in shelters, and sort of as a city and as a society, we should never allow that. So we want to make sure to also be finding and investing in all the solutions to get people out of homelessness and into stable housing.
Right. Yeah, there's certainly some big pieces of the upstream often with the solution feeling like it's on the federal side to do more to fund the larger rental assistance programs, but potentially more we need to do and think about as a district as well. In one of the questions that we had early on from Chris White is one that I've heard property owners and folks in the rental operations space talking about since very early in the pandemic, and it's really about competing with private equity firms, and how you know, what we saw in the foreclosure and mortgage crisis was that, you know, big behemoths with no real interest in being a responsible operator, just seeking to either, you know, hold and cash out later or milk for the short term, were, you know, being very smart and strategic and using, you know, sophisticated financial modeling to try to find properties and get a hold of them. And there's a lot of concern right now that if property owners are finding themselves in a rough state, that private equity firms, you know, may be doing the same thing with multifamily acquisitions right now. So are any of the partners that you work with or see, or maybe if, you know, if there's anybody who wants to sort of chime in from the chat as well, are you seeing anything about socially oriented organizations or nonprofits trying to do better at you know, at least keeping up with, if not out competing, some of these private equity firms? Or do you have, you know, ideas about how we should get prepared and what more the council maybe needs to do to be able to help out there? Can take maybe Beth first, and then see what if.
I can mention a couple things. I mean, I do think it's important for tenants to keep in mind that to the extent landlords bear the brunt of this crisis, we may see things that don't help tenants either, like affordable housing, you know, being pushed into bankruptcy or foreclosure or sale where a certain affordability may be lost. We are certainly worried about bankruptcy cases because the Tenant Opportunity to Purchase Act does not apply when an owner goes into bankruptcy. And we've seen cases where owners have deliberately filed for bankruptcy to avoid TOPA. And then we, you know, end up kind of in a race at the courthouse to try to get those buildings in the hands of affordable housing developers and not others. And so that we are involved in one of those cases right now at Legal Aid. And, you know, foreclosure also can be problematic, and we're worried about that. And I think those are things that the council also can look at, especially maybe early next year. I recognize the rest of the year is going to be quite busy. You know, for example, there was a bill introduced about bankruptcy and TOPA. So are there some structural things like that that we really need to look at, you know, to prevent buildings, especially affordable buildings, from turning over to new owners and not being affordable anymore. I have to mention strengthening rent control there, because some of the problems with rent control that we've seen have led to building prices in the market being very high, which prevents affordable housing developers often from being able to bid for them and compete. And that's things like voluntary agreements and, you know, the assumption kind of built into the speculative price that you'll be able to do these really large rent increases. So that is something that, you know, we think certainly needs to be taken a look at as well.
Thanks, Beth. So if we could sort of take a moment here and think about the fact that there was a crisis in homelessness, there was a crisis in the rental market before. You know, what are some of the things that each of you would want the district, both community members and lawmakers and policymakers, program implementers, to be thinking right now about ways to use this moment where we're all focused on the problem to solve not just the pandemic problem, but, you know, maybe move a little bit farther ahead into something that does look like a more equitable and just system. So maybe we can start with kind of do a Susan, Adam, Beth on that.
So I think that one of the big things that this pandemic has exposed, but that was there previously, was, as I mentioned in the presentation that I gave, the gaps in technology and accessibility to what kind of we now in this world are using on an everyday basis. Even prior to the pandemic, when we had applicants who had to turn in documentation for programs, even on a very basic level, it is difficult, and it was difficult for many, many people. And it wasn't really lack of knowledge on using technology as much as just having the technology, although lack of knowledge is also there. And so that disparity became even greater once the pandemic hit. And even, us at Housing Counseling Services, we shifted to, an online model on how to assist our clients. And that change took a lot out of us, but also took a lot of learning and strategizing and understanding and money to do. And those are things that our clients just don't have access to. And if that piece of it, I think, can be addressed in a much more holistic way, then I think access to a lot of these programs will increase, and it won't be as hard for someone to apply for a program and then get the information that's needed to an agency, and then to get a decision and to have funds distributed. So, I mean, that's really, I think, one of the biggest things that we've seen. And I really would like the district to look at that as, as something that needs to be addressed and solved, not just during the pandemic, but even beyond this.
Thanks. Adam, what would you do in taking this moment to fix something more?
I think of, two broad areas. One, just on the topic of ending homelessness and trying to use this opportunity where people are thinking about housing instability and how many people are going to become homeless and what's going to happen. Using that to remind everyone that we know the solutions to end homelessness. It's not like we don't have a roadmap to get there. We know that housing ends homelessness. We have a lot of different, housing options in our toolkit, whether it's permanent supportive housing or other broad affordable housing things that we know work, lots of research that show it work. And we just need the public will and the, sort of collective belief to put it into practice. I'd say the second thing that is a good opportunity in trying to figure out how to respond to this pandemic is that, we know how to end homelessness for everyone who's homeless now, but we'll never really get to that point where homelessness is, brief, rare, and non-recurring until we're addressing with the upstream systems that are, pushing people into homelessness. So, that's where looking at what is the federal government doing as a partner to really be investing in affordable housing? How's that going to change things? How are we looking at, our responsibilities to returning citizens and sort of all the inequities in the criminal justice system and dealing with some of those so that isn't such a driver into homelessness? How are we looking at some of the big health disparities that are also getting, highlighted just about how COVID disproportionately impacts people? How do we use that to shine a spotlight on, health disparities and how those sort of health crises are often a driver into homelessness? So I think that mixture of knowing, we know the solution, we just need to do it, and let's all stay really focused on what are the upstream systems that are pushing people into homelessness.
I agree with all of those things, and this may be echoing what Adam said, but one of my first jobs doing poverty work, one of the interview questions was, what is the single biggest cause of poverty? And, I gave some ridiculous answer about all kinds of things, about education and housing conditions and so forth. And I was hired for the job. And then I later asked the woman who asked the interview question, what were you looking for me to say? She's like, it's money. It's lack of money. It's like, oh, yeah, that's obvious. We have to think about how we prioritize money. And, you know, the council has many demands on it for the budget, but the budget is a moral document of our values. And so as a district, and so I think we just have to keep challenging ourselves and policymakers to make sure it reflects our values. And I think that goes to Adam's point that we kind of know what we need to do, and we know what we need to do for long-term affordable housing, and it just costs a lot of money and requires reallocation of resources and rethinking revenue and taxes and so forth. The other thing I would say about that is it's easy. So many folks in the district struggle with paying for housing at multiple income levels, but we need to keep remembering that it's the families with the lowest income who suffer the most. They are the ones who, you know, are paying 2/3 or more, 80% or more of their income on rent. And about 90% of those households are headed by a person of color. So it's clearly a racial justice, race equity issue. And public housing, which, you know, is for those families. You know, we are about to, you know, face implementation maybe of proposals to demolish 10 public housing properties and thousands of units. And I've dealt with tenants living in privatized public housing properties, and that is not the direction that I want our public housing program to go in. That's a federal problem as well. But, you know, the Housing Production Trust Fund, it doesn't meet the targets for the families at the, you know, at the bottom. Councilmember Silverman has, you know, put a lot of focus on that issue and on public housing, I will say. And so I think we just need to remember that even though folks may be suffering at all income levels in some sense, it is the families with the least income that are always being pushed out and displaced and suffering the effects the most. And we really need to focus on those families.
Thanks, Beth. I appreciate that acknowledgement that, you know, the budget is a moral document, and we make our decisions about where we see district residents' resources and taxpayers' resources needing to go, and, you know, sometimes make decisions not to raise taxes that pull well, and you know, but in the end we have requirements to hit certain timelines, and to, you know, like it's this it's one of the craziest bits, and the federal government doesn't have any timelines for its budget, and, you know, effectively anymore, right? And and then they don't have to be balanced, and you know, but then again, you know, until we're 51 or 2, I don't care which, we can, you know, we don't really have much say in being able to tell the federal government that, hey, you need to actually fund some of these things better. I was struck by, you know, Susan, in your comments about technology, that it is really hard for an organization and for people to get used to doing things a different way. When I worked on the landlord tenant hotline, it had been ages since they took people in person, and sometimes you get a knock on the door because somebody remembered, like, that's how you get in, right? You like go and you get your visit, because sometimes the lines are real busy. So the ERAP process and the chat process, there's a number of organizations you can potentially go to. There's this online form, which, from having tried to help a constituent with it, it's a little bit clunky, confusing. We had a question come through about, you know, how complicated and hard it is to navigate, even with effective case management. So I'm wondering if you know, from your experience with this program, have a sense of, you know, things we could do better, whether it's, you know, is it, and who might be able to help with that best? Like, is it the council having a role in some place? Is it individual providers? Is it guidance from DHCD?
Mm-hmm.
You know, how do we get that program to work better, both now and long term?
Well, I do think that, just if I want to speak on the portal itself, where you actually go to put in your information to get an appointment, that portal is very limited right now in what it can do. And I don't think it's by any fault of, you know, DHS or DHCD. I'm sure it ties back to money, funding, getting the program up and running. And so it only allows you to access it on a computer, where a lot of, our clients use their phone as their main way of applying for things, getting information, accessing things. So and you're not able to do anything on the phone for that. So that is an issue. You must have a desktop that you use. And so addressing that portion of it, I think is really key and essential. And also making it available in more languages than what is currently available. Because right now I believe it's only in English. There are some instructions in Spanish, and there may be some links to a couple of other languages, but you cannot do the form in other languages. And I mean, we do think at Housing Counseling Services, we absolutely think that this is a great thing that DHS and then DHCD for CHAP has been able to roll out, because it does provide people with more access to get appointments. But yes, it is a portal that you have to navigate. The questions are designed to help someone know if they're eligible for ERAP, and then also now CHAP. And so, yeah, there are a few questions that could get a little tedious, just because we're trying to make sure that someone is getting served in the best way and is not accessing a program that then they have to do an appointment where they just get denied. But I do think accessibility initially for the portal is important to get addressed. I also think with this emergency legislation now, the process or the feeling of it being so clunky will go down, because I think the clunkiness comes in with documentation and having to supply the documentation. And if, due to the legislation that's been passed, if clients don't have to supply the same level of documentation that they had to previously, I think that feeling of it being tedious and clunky is going to start dissipating a little bit, because they won't have to turn in as many documents. They can self-certify for many things. And I think it also will help because the amount of assistance that they're going to be getting is going to go up, because the pandemic has now been going on for months and months and months. And so I think that those things are going to help that clunky feeling. At Housing, I mean, I unfortunately can't speak for other agencies, but at Housing Counseling Services, we also have all those other ways to access the programs by phone and by email. So that if people are having issues with the portal or cannot access it because they don't have a laptop or a desktop, they can then try to access ERAP and CHAP through us in a one-on-one basis. We just recommend the portal because of the fact that it gives you access to 6 different agencies with many different schedules. Sorry if I answered the question exactly what you wanted me to, but I do think that, it sort of ties back to the whole like money and technology, even on this side of it, would aid everything to be better funneled to the residents in the district that really need it the most.
Yeah, thank you, Susan. I think that is really helpful for us to think about. Desktops are not necessarily the best way to reach people who are in a crisis. So we're at 2:58. I cannot even believe the speed that the conversation went. Before I hand it back over to Hallie, I want to challenge all of us to think about later and mull on, and feel free to get in touch with any of us here. Contact me, contact council members, etc. With this idea of what do we do when we have challenges and disputes with neighbors in an ownership situation, because I desperately want to think about what the tools are that are hidden in that dispute resolution toolbox under eviction, and how we actually get to them a bit more. So thanks, Susan and Adam and Beth, and thanks, Hallie, and all the CNHED folks for having us.
Yes, thank you so much to our speakers, our panelists. You guys bring a lot of great insight and a lot of great experience to this conversation, so we really appreciate it. There are a lot of questions on whether or not this presentation will be made available, and it will be. Once this recording is done buffering or whatever it does in the cloud, we'll be putting it on YouTube, and I'll send out an email with the link for the recording as well as an attachment with this presentation. So you'll be able to see it. And as this was marketed, this is an encore session for the Community Development Week CNHED hosted last week. And so we'd like to thank our sponsors, our two main sponsors for Community Development Week, which is DC Housing Finance Agency and PNC Bank. So thank you so much for helping us with Community Development Week this year. They've been great sponsors. And with that, I'll go ahead and close it out and say thank you once again to everyone, and thank you for attending. And look for an email with all of the recordings in the presentation. Alrighty. Bye, everybody.